Hey guys, welcome to Speech Fact Friday. I'm Emily. Today our fact is going to be all about what does a speech language pathologist do?
Alright, we got dysphagia, cognition, motor speech, fluency, voice, receptive language, expressive language, articulation. I can't really think there's so many.
There are so many things that a speech language pathologist actually does, and the title that we have does not encompass all of those things. So let's just jump right into this video. We're going to go through what they do on a daily basis and what kind of settings we work in. Okay, so first and foremost, obviously we work on speech. That's usually what comes to mind for most people when they think of a speech therapist. This is going to include speech impediments. This is going to include language development. This is going to include motor speech disorders. This is going to include fluency, which is stuttering. So there's so many things that even fall under that umbrella term itself. Actually, speech language pathologist. So receptive and expressive language, I guess we would put under the language category. But speech language pathologist, most people think of a clinic setting or a school setting working on speech sounds. There's also the medical side, so you can work in hospitals, nursing homes, rehab facilities, outpatient clinics, so many different settings. And what we're working on in the medical side is a lot of cognition. So for example, you have a patient who has had a stroke and now has lost their ability to speak, might have some sort of aphasia or cognition impairment due to their stroke. We're going to be working on that. We're also going to be working on swallowing. A lot of times after patients have had a TBI or stroke, the swallowing can become impaired, and that's actually our specialty, which a lot of people don't know that a speech language pathologist does. So we're helping rebuild that swallow. We're going to give them a safe diet to work on. What kind of food consistency can they handle? And then we're going to teach them therapeutic strategies to help build that swallow back up. If there's something that's permanently impaired, we're going to teach them strategies on how to swallow safely with that impairment for the rest of their life. In the medical setting, we're also working on voice. So a lot of times your vocal cords might become paralyzed or injured or just impaired from a cognitive standpoint, the nerves not working correctly. So we're working on voice. We're going to help teach good speaking and voice strategies so that you're not damaging your vocal folds. If they are damaged, we're going to teach therapeutic strategies on how to be gentle on them so they can heal to get back to a good place. Some speech language pathologists might even specialize in pitch, so working with singers. Most of us don't though. We're also working with feeding. So a lot of children might have food sensitivities. You'll see this a lot with the ASD population, autism spectrum disorder. They're gonna have those sensitivities. Certain things are gonna feel funny to them or taste funny to them, or the temperature or texture just isn't gonna be right. So we're gonna work on encouraging them to try different varieties of foods. And of course, we're working on communication. If you check out my Tuesday video on baby signs, you'll see that obviously we're encouraging that communication back and forth with one another. I think I covered everything. There's so many things a speech language pathologist does, really and truly. I'll actually attach in the description below the link to our scope of practice if you're really interested in seeing all that we do and all the settings we work in. It's such a fun field. So whether you're looking to becoming a speech language pathologist or you're wondering, do I need to go to a speech language pathologist? There's so many things that we actually can treat and give you therapy for. Don't forget to like if this video was helpful, and please subscribe to my channel so you don't miss Speech Tip Tuesday or Speech Fact Friday. Thanks.